The cause of death in case of coronavirus is two things. Deaths from Covid-19 are due to cytokine storm syndrome and fulminant myocarditis. During a cytokine storm, an excessive immune response ravages healthy lung tissue, leading to acute respiratory distress and multi-organ failure. Cytokines are the chemicals that are released by cells during inflammation. All COVID-19 patients sick enough for hospitalization should be given a serum ferritin blood test. This is because there are elevated serum ferritin values, and they are a good first screening tool for the possibility of a cytokine storm syndrome in sick patients with high fevers. So, the presence of high ferritin values it may be indicative of coronavirus infection. Due to this, tocilizumab, that is an uh, it is a drug which may be used for interleukin 6 blockade. So it may be used for the treatment of coronavirus disease 19. Treating COVID-19 infected patients with cytokine storm syndrome with interleukin 6 blockade has recently been reported in China with successful outcomes. So interleukin 6 is an intermediate in the cytokine storm syndrome, and if this is blocked by tocilizumab, then the progression of the disease can be stopped, and there may be recovery of the patient, and death may be avoided. The second reason that is cited for the death of patients suffering from coronavirus disease 2019 is fulminant myocarditis, which is the inflammation of the middle muscle of the heart wall. The inner muscle is known as endocardium, and the middle muscle is known as myocardium, and the outer coat is known as pericardium. When there is inflammation of the myocardium, it is known as myocarditis. Fulminant myocarditis is a very severe form of myocarditis. Fulminant myocarditis has also been reported in patients with COVID-19, and fulminant myocarditis is primarily caused by infection with viruses. It is also caused by other viruses in addition to the coronavirus. It arises quickly, progresses rapidly, and may lead to a severe heart failure or circulatory failure, presenting as rapid onset hypotension and cardiogenic shock with mortality rates as high as 50 to 70%. So, in case of fulminant myocarditis, there is severe heart failure, or there may be a circulatory failure. That is, the heart is not able to pump enough blood to keep the body tissues perfused, as a result of which there may be a hypotension. There will be no blood pressure when there is no force, when the heart does not have sufficient force to pump blood. Therefore, there will be no blood pressure, and that is hypotension, or lesser blood pressure. That is hypotension. This may mimic a cardiogenic shock, which is a shock in which the heart is not able to pump enough blood. So these mortality rates are very alarming. They are 50 to 70%. Physicians should pay attention not only to the symptoms of respiratory dysfunction but also the symptoms of cardiac injury. So this is how coronavirus causes death.